Welcome to this Catholic Bioethics Moment. I'm Dr. Bridget Campion, and I'm speaking to Dr. Moira McQueen about the use of pain relief at the end of life. Moira, sometimes patients at the end of life, and I'm thinking of patients with terminal cancer, it's possible that they are in a great deal of pain. And I know that this doesn't happen all the time, but sometimes the dilemma comes up with they have developed such a tolerance of the morphine that to address the pain, they will have to have a very high dosage of morphine. And sometimes doctors and families are very hesitant about giving the patient that much morphine to address the pain. They fear that it has the possibility of suppressing the respiratory drive, the possibility of hastening death. What would you say about a case like that?
When we translate that into a Catholic question of am I allowed to hasten death, if I ask the question like that, the answer is absolutely not. But in this case, we're talking about something that's really quite different. So when we're talking about the necessity for heavier doses of morphine pain medication to relieve suffering, that question was asked when opioids first started to be used, so back in the early 1950s.
Right.
And Pius XII, the Pope, then gave a very, very clear answer to it because the question about hastening death was being raised even then.
Right.
So he said that if we are really suffering, then, and as usual, it has to be to a great extent, and medical people would agree. He said if you're taking that for suffering, then you're allowed to take it. And his very words were, even if it hastens death. And he was able to say that because the direct intention, as we would talk about in moral theology, is not to end one's life, but the direct intention is to relieve suffering. So the relief of suffering is a very valid principle, and so from then on it's become very clear in Catholic teaching that the cancer patient or any other patient who is suffering from extreme pain should and could take the medication without worrying about the idea that it's hastening death.
So intention is coming into this very much.
Very much.
Because when we're talking about the administration of morphine, it could look like, at least from the outside, we have this injection of morphine, and perhaps we also have a hastened death. How is this different from what's being proposed for physician-assisted death, where we have an injection leading to death?
Right.
So that, but you're saying that there are essential differences between these two acts.
Oh, essential differences, and that is the intention, that the person is asking for death, and a physician will administer enough of a drug, not necessarily morphine, another type of drug.
So it's a direct cause and effect.
Direct cause and effect.
Direct cause and effect. Yes.
Whereas this other way around, I think it's very clear when people are asking for sufficient level of medication to help tolerate the pain. And I think it becomes very clear what the intention is, both from the patient's point of view, who still must consent or even ask for the drug. It's not the physician's duty to administer it without the patient actually saying yes in the first place.
And all directed towards addressing the pain,
absolutely,
not towards ending the patient's life. So again, what is you were mentioning Pius XII.
Yes.
What is the Church teaching on this use of pain relief at the end of life?
Well, he, in an address to anesthesiologists, he has this very clear statement about if it's intended to relieve suffering, then it's valid for Catholics to actually take that medication. Nobody is saying that one should suffer if there is obviously pain relief available for that.
Good. Thank you so much.